The country's hospitals enter a state of crisis every December, which is a depressingly recurrent occurrence. The United Kingdom is bracing itself for an increase in flu illnesses as winter draws closer. However, it is unclear what is driving the current spike in these infections. Some authorities in the field of medicine believe it may be related to the aftermath of the COVID epidemic. Hello, and welcome to our channel, Primetime TV. Make sure you subscribe to the channel and hit that bell icon to get notified whenever our channel is up with a new video. We will keep you updated with whatever is happening around the world, so stay tuned. Now let's have a look at what exactly is the post-pandemic immunity gap, and what the UK's population is going through as a direct result of it. But before that, let's understand what immunity gap is. Understanding the immunity gap. When exposed to viruses, children develop a protective immune response of their own accord. The majority of children develop RSV before their second birthday, according to the Centers for Disease Control and Prevention in the United States. Babies receive some degree of passive protection from their moms, since their mothers carry antibodies onto them through their breast milk. But for a number of years after the pandemic, there was very minimal risk of respiratory syncytial virus, RSV, infection for children who were born during the epidemic or the people who were around them. This was also true for other viruses. They either lost some or all of their immunity over time. Therefore, when those young children and their parents started interacting with other people, the risk of illness increased for all of them. A group of vulnerable individuals who avoided infection and consequently do not have pathogen-specific immunity to guard against future infection has been developed as a result of decreased exposure to endemic viruses, which has resulted in an immunity gap. But RSV is not the only infection that is causing worry among the population. The United Kingdom is experiencing strep outbreak. This winter has also seen an increase in the number of cases of other ailments, such as the bacterial infection known as strep A. The question now is, what exactly is strep A? Strep A, also known as Streptococcus pyogenes, has been linked to the development of ailments such as strep throat and scarlet fever. Symptoms that may be present include a rash that is red in color, enlarged glands in the neck, loss of appetite, nausea or vomiting. Cases that are considered mild typically resolve on their own or with the help of antibiotic treatment. In more severe cases, infections may be invasive group as Streptococcus infections, IgAs, which can lead to much more serious illnesses such as meningitis, necrotizing fasciitis, streptococcal toxic shock syndrome, and even death. Meningitis is one of the most serious complications that can result from IgAs infections. However, IgAs infections are extremely uncommon. The death rate due to strep A, according to statistics provided by the United Kingdom government, a total of 4,622 cases of scarlet fever were reported in England over the course of 10 weeks, with 851 instances being reported in a single week. In the 5 years prior to this one, there were an average of 1,294 cases throughout the 10 weeks that occurred at this time of the year. In addition, within 7 days after the diagnosis of an IgAs infection, there have been 5 reported cases of fatalities in children under the age of 10 years old. In 2017, there were 4 people who passed away during this time period, which was the last year with the highest number of deaths reported. The increase in cases of strep A is a possibility that it is due to the same factors as the increase in RSV cases. Are children getting sick from COVID lockdowns? Children's immune systems were not compromised by COVID lockdowns, as predicted by the hygiene theory, but they were protected from the respiratory viruses and germs to which they would have otherwise been exposed had the outbreak not occurred. Since we've only been getting back to normal over the past year and a half, germs have been multiplying rapidly to fill the void. And because our children haven't had the chance to develop immunity through the usual routes, they're particularly vulnerable. Emory University human immunology expert Matthew Woodruff suggests immunity debt as a potential cause, or the idea that we are just having a backlog of devastating childhood infections. A worldwide lockdown would not only disrupt the spread of COVID, but also the usual transmission of all infections. More than one virus may be at play, which may increase the severity of these infections in children. So, What can you do? In order to prevent the transmission of respiratory viruses like RSV and strep A, you and your kids can take several measures that will seem very familiar. Be clean and wash your hands. Instead of using your hands, a tissue or your elbow is a better choice for a sneeze or cough. Improve your resistance to illness by getting lots of sleep and eating right. If you are unwell, you should definitely be wearing a mask. Most importantly, rest at home if you're feeling ill. Evidently, all of these non-pharmaceutical measures work, and the more we can do to reduce the spread of any of these diseases, the better. Are you taking proper precautions? Let us know in the comments. Don't forget to like the video and share it with your friends and family to make them aware of what is currently happening around the world. We will keep you updated, so stay tuned.